This child was diagnosed with malaria, but his high fever won't go away. He's been in the hospital for 2 weeks, and now his mother has run out of money for medicine.
I don't have the funds. I went to a private clinic, but I soon ran out of money and we had to leave. Without money, they can't do anything. That's what they tell you. The only way I can buy medicine is if someone gives me money as a gift. I haven't eaten anything since this morning.
Adeku's son Raphael needs to see a specialist, but the staff at Togo's biggest hospital is on strike. Only emergency treatment is available. David Dosseh is one of the strike leaders and has already been arrested twice as a result. The doctor says he has no choice. He refuses to support a healthcare policy that he says is deplorable.
We've been trained in a profession that's meant to cure people of disease. But at the moment, we can't save any lives. It's difficult. We're on strike to change the situation, which is very bad. We don't have enough staff or enough equipment. That's why we're out here.
Most of the equipment in the state-run hospitals is antiquated, and the air conditioning doesn't work.
The bad shape of the country's health system is not only visible in the capital's biggest hospital, it's also visible in the statistics. On average, there's only 3 healthcare workers for about 10,000 residents in Togo. This is almost 4 times less than in neighboring Ghana and way below the international standard.
Opposition groups, teachers and doctors have been taking to the streets for months. A confrontation erupted over the weekend following a recent ban on protest. According to the communication minister, a commission has been appointed to deal with the healthcare crisis.
We hope we can bring all sides together on this issue. The government has to take the overall economic situation into consideration and then decide which problems to address first.
That's something Dr. David Dosseh says he's heard all too often.
It's clear that this is a government strategy to delay the process. What it communicates doesn't reflect reality. That's a shame. You get the impression that the government has different priorities than the concrete problems of the population.
That's why Dr. Dosseh and many of his colleagues say they have no other option than to earn their living in private clinics instead of the state-run hospitals. And it's those very clinics that offer treatment that's unaffordable to most Togolese, including Alice Adeku and her son Raphael.